Good night everyone. Today we want to talk about the premature ejaculation. Premature ejaculation is one of the most problems that faced the married couples. We talked about that problem last time, and we know that there is a therapies for the problem. Also, we will talk about the impotence and how we solve it. Even the small penis now had a therapy, and we will know it all with Dr. Alaa AbdAlaziz Aglan, Director of the Scientific Center of Cosmetic Surgery and Penis. Welcome. At first, we want to know what is the premature ejaculation and its reasons and how to solve it.
Okay, the book says that the premature ejaculation took about from 3 to 5 minutes, and others say that it took about from 5 to 7 minutes. But we can say that it is a theoretical, not realistic. So I say that the premature ejaculation comes when the other one doesn't reach its trance. There is 27% of women reaches the trance in about a minute, and the other 90% in about 7 minutes. So we want a solution to every problem. All the operations that was doing for premature ejaculation depends on anesthesia nerve, cut it or burn it by waves, but these weren't a permanent solution. It at least takes 9 months. And the problem comes again also. These are very expensive, at least $3,500, and in some cases the patient isn't responding. There is some physiologists say that you can think of other things when you have sex, but that would be a loss of pleasure. Some says that doing a mastrogenesis was good and it was a global solution, and actually it helped a lot of people, but after 3 years it became very useless and made the tension nervous. There is also the medical solution, but it has some side effects and causes drowsiness and increase in the heartbeats, pain in the stomach. Here in Egypt, the man who took Viagra take it in secret and don't tell his wife, because they connect between masculinity and manhood, also called philic identity, that the man sees that the penis is the key of his personality, but that's definitely not true. So to solve the problem, I invented a surgery under my name in the intellectual property, and I am using it since 5 years ago, and it works very well. Premature ejaculation had 3 reasons: the brain, the muscles that influencing in the ejaculation process, and the nerve. Other surgeries healed just one for these 3, so it doesn't heal all the patients. There is the sexual dreams. At the dream, there is a phase called rapid eye. They found that the dream just took 6 seconds, and the ejaculation process just took 0.48 of a second, so the brain isn't the first dominant. The ejaculation will take half a second. The muscle, when we push the frontal part of the penis, the muscle contractility, and during the sex, the muscle contractility many times, and when that happened, the man ejaculated. So I connected between these two and started to cut the muscle and see what will happen. So I cut the 2 parts and I found out that 60% of the patients completely healed. There is other problems, like some patient told me that they are very sensitive from penis skin, and they tries to put some sprays on the penis but without no result. So we found out that the sensitive area of the penis is in the lower part called delta, about 1 centimeter. We found out if we remove this part from the penis, it will improve the ejaculation, and that was very local anesthetic on specific parts of the penis. Then we found that when we do the cut of the 2 muscles and remove the delta, it will heal the patient about 97%. Now we have just 4% of the patients have the brain control to the ejaculation, and that is the problem, causes the patient takes pills and also with no effects. But if we do the operation and take the pills, it will affect very well. And the drugs does this time will be little than before. After that researches and operations, the normal people also came to me to increase the time of ejaculation. So we started to do operations on normal people, and it works very well, like the Viagra.
The AD of erectile dysfunction is a problem for most of the men, and the stents took place to solve the problem. What is the evolution that happened in that stents?
The penis erection or boner is a blood influx. There is some symptoms such vesicularis venous appear with the diabetes patients come at the age of 40. Sometimes come at younger age. There was a patient came to me was 17 years old and we made him a stent. So it's considered a genetic weakness and that is so rare.
So, how the patient know that he had erectile dysfunction?
He evaluated from his history. Is he was good before and now not?
So, what does the stents do?
It is a replacement of the blood influx. It is something like a pen made of silicone and inside it a silver material. We put it inside the penis. There is many types of stents, inflatable ones and semi-flexible ones. It is the best for me and it had no problems.
Does it make any problem after erection?
No, it had no problems and its flexibility with the body. Some diabetes patient asks me, is there any problems with the stents in my case? No, there is no problem. First we set a sugar in the blood, then we do the operation and put the stent.
Do you make the operation by partly anesthetic or full anesthetic?
We do it with the two types, actually, and all the people should know that. The normal stent shortens the penis from 2.5 to 4 centimeters. But I do my operation and enlarge the penis with the stent also, and I can also do the subcutaneous injection so that it heals all the types of the problem that face the penis.